Hi, my name is Michelle Vuong. Today I'm going to talk about the curriculum design project. That's where I created the ideal nursing program for a Bachelor of Science of Nursing. It is through Colorado State University at the Pueblo campus for Nursing 5754. To begin with, I'm going to talk about the structure, and so I have chosen a 4-year program divided into semesters with nursing curriculum starting in year 1. I believe it is beneficial to have the students start right away so they can slowly learn about nursing as a profession and they can make sure that they believe it is the right fit for them. Prior to being accepted into the program, the students would have a rigorous and difficult application process before they get accepted into the nursing school. Another point to having nursing curriculum starting year 1 is so that the students have a longer amount of time to learn and retain the information instead of kind of cramming it into the last 2 years of nursing school. The model that I have selected is an integrated model, and that is classes that involve nursing, non-nursing support, and elective courses. These concepts are integrated throughout the curriculum in a meaningful way so that the students can get a well-rounded education. The method of program delivery is going to be hybrid, lab and simulation, clinical, and service projects. And the method of program delivery is basically the means by which the curriculum is offered and accessed by students. Hybrid means that the students can be in the classroom and also online, and so we will kind of flip-flop between the two of those. According to the curriculum development of nursing education, online classes are beneficial because it accommodates the students' flexible schedules that involve work, other stressors, and personal life that a student can have going on in their life. Lab and simulation is going to allow the students to have an opportunity to practice their hand-on skills on a mannequin or in the clinical simulation lab in a very safe environment. They can use these skills that they learned in simulation to apply to a clinical where they can practice on like real patients in like a hospital setting. And then the service projects are going to be able to have the students connect with the community by, focusing on primary and preventative care. As faculty, the key is to create a community of inquiry in which social, cognitive, and teaching present flourishes. And so having multiple methods of program delivery is going to allow the students more opportunity to be able to understand what we're trying to teach them. Partnerships are formal arrangements that we can partner up with, and so I've decided to team up with hospitals so that the students can get some clinical experience interacting with like real patients and different patient populations. Moving on, the organizational strategy that I have chosen is core curriculum design and the building blocks design. Core curriculum design is the core to all curricula that every nursing student needs to know. For example, communication. Communication is defined as the exchange of information, thoughts, and feelings through a variety of mechanisms. Effective communication between nurses and individuals and between nurses and other healthcare professionals is necessary for the delivery of high-quality, individualized nursing care. That being said, I would incorporate communication into a class in the beginning of the first year, such as Introduction to Nursing, and that way the students can learn how to communicate with others early into the program, and they can use that skill throughout the program and then into their nursing career. The building blocks design is a body of knowledge or skills organized into a pyramid-like arrangement. The bottom of the base is foundational learning, the middle portion is increased specialized knowledge, and the top is in-depth knowledge. And so the way that this works is you build up your knowledge, and so we can keep revisiting concepts and adding on to those concepts until the students understand and become like an expert in that topic. Specific tasks are tasks or skills that students need to be exposed to. For example, IV placement or Foley placement. And so the students can practice these skills in simulation and then also practice those skills on real patients in clinical. Educational learning theories are used to achieve pedagogy, and pedagogy is like formal teaching. So the theories that I have chosen are humanism, constructivism, and experiential learning. I'll first by explaining what humanism is, and so that's the concept and mindset that each individual has their own thought about the world in which they live in. Humanism addresses students as a whole, and we want them to learn in like a really safe learning environment, and we really want them to progress towards like autonomy. And so humanism is kind of addressing the student as a multiple individualized being, similar to how nurses treat patients as an individual. We want to do the same thing as faculty for our students. Constructivism is knowledge based off prior learning, and meaningful learning is learned through interactions. And so constructivism is kind of where you can connect what you learn in class to a patient you had in clinical, for example. And so that's why it's really important to offer all those opportunities so that the student can like make those meaningful interactions in like light bulbs moments. Experiential learning is learning through experience, observation, reflection, and redoing. And this is really important because nursing is like doing and like really getting your hands on, and so it's important for these students to like really be able to experience this in nursing school. With all of those learning theories, I believe that kind of poses a lot of teaching implications. And so as faculty, we want these students to be successful. And by doing that, there are a couple things that we want to be able to acknowledge. Number one, learning is motivated by desire for personal growth. And so every student learns at their own pace. And so by being able to give individualized teaching, this will be able to have the students succeed. We also, as faculty, need to value students as individuals by recognizing the complexity of personal, social, and psychological relationships. We want to see the well-beings as a complex, interrelated whole, and we can do that by having the students active learning and having them self-evaluate themselves as well. This brings me into the first year of nursing school, and this is where I've laid out like a timeline of the classes that they will take. And so first semester of their first year of nursing school, they'll be in classes such as Introduction to Nursing, Chemistry, Human Anatomy and Physiology with the lab component, an elective of their choice, and freshman seminar. I'll explain details about all of these things, but I'd first like to start off with explaining that, freshman seminar is going to help those students develop research skills, teach them what their resources are, and just give them an extra layer of support as they transition into nursing school. I'd also like to touch on the fact that I have Human Anatomy and Physiology in both semesters of the first year. I believe this is more important because the students have time to learn and retain what we're teaching them, instead of if we had it into one semester, we'd have to go twice as fast to cover all the material. And so this way, the students have more time to retain that core knowledge that's so important that they'll take on as they move on to pathophysiology and pharmacology and etc. Moving on to the second semester, so that's when they'll continue Introduction to Nursing with a lab component, a general biochemistry, human anatomy and physiology too, with the lab and psychology. And so in that lab in the Introduction to Nursing course, I think the students can learn CNA skills. And so if they want to get a CNA job over the summer, they would have the skills to do that. And that way they can really get exposed to being comfortable working with patients, and just kind of get used to all of the equipment that's involved. Before we move on, I'd like to touch on the mandatory electives. And so these are classes like English, math, health electives, and nursing electives. And so these are important so that the students can have a really well-rounded education. According to Southern New Hampshire University, general education courses provide a wide breadth of learning opportunities and skills that can be applied to everyday life. And so these general education curriculum is meant to provide a foundation that promotes successful behaviors that lead to lifelong learning. And this is really important for the students to have because they might have multiple jobs outside of nursing afterward, and so I want them to have a well-rounded education. That brings me to the second year of nursing school, and so the students will be able to participate in classes like nursing assessment with a lab component, nutrition, pathophysiology, mental health, and an elective of their choice. And so basically the students are going to kind of get their hands in difficult classes. And so I've divided the pathophysiology for the same reason that the students were in a whole year of anatomy and physiology. In the second semester of the second year, the students will take nursing health assessment and fundamentals with the clinical component, pathophysiology 2, pharmacology, and elective of their choice. In this clinical with the nursing health assessment, this is the first time that they'll have like a clinical assignment instead of like a lab component. And so the students can really get excited for working with like real patients. Patho and pharmacology are pretty difficult classes, so I've only had 4 classes, and so that way the students can really focus on those classes. In the third year of the nursing program, the students will be in classes such as evidence-based research, community, maternity with clinicals, and then an elective of their choice. And so I've chosen so many like clinical experiences because I want the students to be able to connect what they learn in lecture to what they are seeing in clinical. And so with more exposure to like different patient populations, the students can also kind of figure out what kind of population do you want to be working with. Do you want to be working with adults? Do you want to be working with kids? Do you want to be working with infants, like neonatal? Do they like critical care? There's so many populations that the students can decide between, so I really want them to be exposed to different patient populations, and that way they can choose when they get out of nursing school. In the second semester of their third year, they're going to be in an adult health nursing theory class with a clinical component and then a pediatric clinical as well with a lecture. And so this way they can get more patient population exposures. I've left this semester pretty flexible, so that way the students can have the opportunity to study abroad if they so wish to do that. And I've decided to do this because it allows the students to immerse themselves in culture, learn independence, and allow them like a very once-in-a-lifetime opportunity. And they can learn so much by bringing what they learned into their patient care when they graduate from nursing school. So I really wanted to give the students that opportunity. Lastly, in the last year of their nursing classes, I will have the students take Adult Health Nursing Theory 2 with a clinical component, a class called Leadership, and that's where we would talk about just like what it means to be a leader at the bedside and what we want our graduates to have as they leave. Nursing care with persons with acute conditions and elective of their choice. And so I'd like to point out that the students will be able to rank their clinicals based on their preferences if they want to see like an ER or an ICU or an OR. And so those choices are going to be up to them, and we will do our best to like pair them up with what their first and second preferences are. In the last semester of nursing school, we would have the students take nursing quality and safety, palliative care, transition into professional nursing practice with a clinical component, and lastly, an elective of their choice. And so that transition class into the nursing practice will help the students learn like resume skills, job interview skills, and will really prepare them for that NCLEX RN exam. According to Marquette University, the more exposure and practice that the students have to these NCLEX examination questions, the higher the pass rate will be. So we really want our students to be prepared for the examination. And that being said, it leads me into my next slide, which is going to be student outcomes. And so at the end of the program, we really want these students to be able to provide safe, quality nursing care to diverse individuals, families, and communities throughout their lifespan, integrate scientific, evidence-based knowledge into their practice, promote and educate individuals to improve health outcomes, develop clinical judgments and solve problems, and then pass the NCLEX RN exam. According to the Board of Nursing Rules Code of Colorado Regulations, the students must pass the NCLEX RN examination before they're able to practice, and so that's definitely an outcome that we want the students to have success in. This leads me to my last slide, and that's the references that I've used when designing my ideal Bachelor Science of Nursing program. I really hope you enjoyed this presentation, and I'm looking forward to hearing yours. Thank you so much. Have a good one.